Hi, I'm Dr. Rob Silverman, Amazon best-selling author of Inside Out Health and host of Proven Health Alternatives. We've got a great episode coming with Dr. Brandon Steele of Cairo Up. You're going to hear some great insights into the growth in research in chiropractic and why you want to implement specific leading-edge techniques and which ones they are. You got to watch. Hey everybody, Dr. Rob Silverman here, Proven Health Alternatives. I have superstar Dr. Brandon Steele, owner of Cairo Up. Dr. Steele, how are you today?
I'm doing well. Thanks for having me on board.
I mean, you look nice and comfortable. I'm going to sit back too. I'm happy to have you. I watch you every week on your Cairo Up minutes and moments. I use Cairo Up in my office. So why don't you tell everybody what Cairo Up is?
KairoUp is a platform. It's one of those things that helps people, whether they're just getting out in school or whether they've been on practice for a while, just work more efficiently and create some systems in your office. I found, just as you found, that as doctors, we need to be doing doctor things, and then we have staff that does staff things, and then we need to automate everything else. And KairoUp is one of those things that does that for us.
Outstanding. And just so everybody knows, I use it. And I caught Dr. Steele off guard. I asked him a question. I want to read your bio. I want to do it a little differently today. So Dr. Steele is currently in private practice at Premier Rehab in the greater St. Louis area. Nice and warm there right about now. He began his career with a postgraduate residency at the Central Institute for Human Performance. During this unique opportunity, he was able to create and implement rehab programs for the members of the St. Louis Cardinals, Rams, and Blues. Dr. Steele currently lectures extensively on evidence-based treatment of musculoskeletal disorders for the University of Bridgeport Diplomate in Orthopedics program. He also serves on the executive board of the Illinois Chiropractic Society. He's a diplomate and a fellow of the Academy of Chiropractic Orthopedists. His mission in practice is to get people in and out of pain as fast as possible and then give each patient the education and rehabilitation to never see them again. Dr. Steele is also the co-founder of CairoUp.com, a resource around the world used by practicing chiros in colleges. You never want to see them again. Expand on that.
That's a tough one. In fact, there's a lot of people who take offense to that when I say that. And it's a unique opportunity I have here in St. Louis. And the unique opportunity is I'm not the only doctor they're seeing. So we get all of our patient referrals from medical doctors, pain management doctors, and orthopedic surgeons. So I'm one cog in the wheel of the people they see. So my job is to get them in and out of pain quickly. And then if I need more extensive rehab, if I need nutrition, I need wellness care, I need general strengthening or surgery, I send them off to the next person. So we're very specialized in that respect as far as pain relief. While that's not every chiropractor, nor should that be every chiropractor's mission, that's just how we run our practice.
So what are the challenges that you see facing healthcare in the next 10 years?
I think we used to think of chiropractors and healthcare as two separate entities. And realistically, with the research coming out, we're really merging and becoming part of mainstream healthcare, which I think is phenomenal. And I think that the reason is because the public and also the medical professionals are seeing the efficiency and effectiveness that we have in our profession. Meaning we're not ordering unnecessary tests, we're not doing unnecessary procedures. We're using simple diagnostics to get people in and out of pain quickly and get them out of their problem fast and efficiently. And I think one thing that we provide that not every provider provides is a patient experience, meaning most patients like to go and see their chiropractor. They feel better when they leave. And I think that we're great at that because we're small business owners, that we understand that every patient that leaves our office needs to be very satisfied. And if they're all promoters of our practice, that's our marketing built in.
I agree with you. I think the patient experience with a chiropractor is a critical element. And part of the patient experience is a lot of evidence-based chiropractic, which you guys specialize in. Speaking of the research and evidence base, in the last 5 years, there's been a plethora of research talking about spinal manipulation and how all this research has been real positive. So why don't you help everybody who's listening explain, whether it's a patient or a chiropractic doctor, how they can improve their clinical results in a patient's perception of spinal manipulation with this new literature that's out?
Yeah, that's really two questions, but it's this kind of the same answer. Is one, you need to have access to that or those journal articles and the new research that comes out, and then we need to be humble enough to understand that what got us here isn't going to get us there. Meaning, what you learned in school and what I learned in school isn't always what's going to be acceptable 20 years later, and that I have to continually refine and adapt my tests and my exercise and my patient education to account for the changing world. So that's probably the first process, which is more of a knowledge transfer process, meaning how fast can I take a journal article and incorporate that into my practice. So that's what I enjoy. That's kind of why KairoUp was invented. But the cool part about that process is that while the practitioner becomes more intelligent, more educated, it still takes educating the patient. And unfortunately, as doctors, we don't get paid to educate patients. We get paid to manipulate and evaluate. And that's often the difficult part, is that we have to take that information and have that trickle down to the patient in a simple, easy, digestible format so they can understand what's going on with them and they can understand their condition just as much as we can, so they can become active participants in their care.
Yeah, I agree with you. And I think you guys do at KairoUp a great job of education. One thing in particular is your disc video.
Yeah.
It is fantastic. So most people think that a disc is, when you have a herniated disc, like say, or disc pathology, it's direct pressure. Mm-hmm. So even our models, the hard models show that. Your video really depicts the liquid and the chemical irritants. And so now you have a mechanical issue causing a biochemical issue, which is really chiropractic. So sure. Why don't you tell some people about some of the videos that you have, your 3 most watched videos, and what doctors, I always like to give lists. I find it so effective on these. So that's got to be one of them.
It's actually quite interesting because our top video, which I don't know how many views it has now, but is on pregnancy and lower back pain. And it's something that we definitely do in Cairo Up, but it's not a big focus of ours. Mm-hmm. However, I think the reason it's so important and it's so popular is because in our videos, we have a pregnant patient doing the videos. So in our blog, we talk about the things you should be doing to pregnant patients, but as you recognize, it's a difficult patient population because they're very worried about what we do to them and what they're putting in their bodies, the positions they're putting their bodies in. So it's a little reassuring to see, which modalities can you do? Which ones should you not do? Which exercises can you do? So that one's been probably one of the more popular ones. And then next on the list is definitely vertigo. And that's something that I believe we are the #1 provider that should be treating vertigo. In starting off in practice, I was a little bit more hesitant because of the more threatening pathology that could be lurking. But now I recognize vertigo on a vast majority of my older patients, and there's a lot we can do for those patients. So differentiating cervicogenic headaches from cervicogenic vertigo versus more serious pathology is our #2 and 3 blog videos that have been viewed.
Wow. I wouldn't have guessed the pregnancy and the vertigo, and I agree with you. And I unfortunately don't do a ton of pregnancy also. Vertigo, a lot. Lower back, 8 out of 10 Americans have lower back pain. I wrote a couple of questions down.
Sure.
Now, as a chiropractor right now, what would you do to improve your market share in the community to cement your future practice success? Because you really spoke about the idea that chiropractic is evolving. I mean, I got out of chiropractic school 20 years ago. I got a very good base education, most of which really has just changed.
Sure. Just like yourself, I've been out for about 10 years now, and I thought just by being clinically sound that patients were going to line up at my door as soon as I got my degree, which didn't happen. I was very fortunate to have a good residency program, have a great background and mentors, but even having that great background didn't bring patients to the door. And the guy I work with now, Tim Bertelsmann, he taught me one thing, and that one thing I think has led to my success in private practice, and that is if you treat patients well, the side effect is getting paid. And if you flip-flop those things, then you flip-flop the business hand, the clinical hand, that's when things go haywire. So I think the #1 thing in practice that I would recommend that improve my market share in my community is transparency. and that I'm very upfront and honest with my patients about what my intentions are. My intentions, just like you read at the very beginning, are to get you in and out of pain as fast as possible and then never see you again. And that doesn't have to be your vision, your mission in your practice, but you should not be afraid to tell your patients your mission. And if your mission is to drive a new BMW every year, well, they're going to see that in the business policies and practices in your office and how you drive a new BMW every year. And not that that's a bad thing. We should be rewarded for the time and the effort that we put in. But as a provider, your first mission should be to get those people, on their way and provide a product they want to buy instead of one that you need to sell. And I think that's probably the biggest piece of the puzzle. And the way that I did that is by providing initial reports and release reports to medical doctors, because all they do is see my failures and your failures. No one goes back to the medical doctor and says, hey, saw Dr. Silverman and I feel great. I just came in to tell you, my back pain's feeling better. They go in because we failed. Well, that happens the same thing in our office. They went and saw their medical doctor and the pain reliever, muscle relaxant, didn't help. So that's why they see us. So we see their failures all day long. They see our failures all day long. And that's what they think that we do, is fail. If they see our successes on a daily basis, that's really how you're going to increase your market share, because they can see your name, your logo, and that you're getting their patients in and out of pain quickly, and hopefully get a good taste in their mouth whenever they hear your name as a chiropractor.
That's great piece of advice. And I kind of like the side effect getting paid. I think that's beautiful. I was told something kind of similar, like, what do you do? And number one thing that very successful chiropractors said to me were, when I say successful, people that I looked up to, got great outcome and everything like that, they said, just treat every patient like you would want your mom to be treated. Yep. Same idea.
Sure.
And you want your mom out of pain as fast as she can, so she doesn't have to come back to you. And then we can talk about wellness and prevention at a later date. What is something that you would want to add to your practice that you haven't found the time, energy, money to do? What's missing?
Well, that's why we're talking to you, actually. Nutrition. It's not that I want to do nutrition. I think that providers who are involved in functional medicine, nutrition, have to own it. That has to be what they do. They have to live, breathe, and own that part of their practice. Right now, I farm out everything I'm not great at. And if I'm not great at something, I'm going to find someone else who's great at it. But in the current literature that comes out as far as tendinopathies or mild traumatic brain injuries, if you're not including nutrition and at least advice on how to decrease inflammation, eat better foods, you're missing half the puzzle. I think that as chiropractors, most of us are trained in the mechanical aspect of getting somebody well, but maybe not as trained, including myself, in the chemical aspect. So right now I have someone I use, but they're not a part of my company. And I think that in the next couple of years, I'll get involved in that side of the healing process.
It's so funny you bring that up, and thanks for the call out. I do believe ultimately the chiropractors, and we're on the same side of the ship, if you will, that it's a mechanical and a biochemical combination.
Sure.
Because the biochemical causes a mechanical fault. The mechanical fault can cause the biochemical fault. It takes a long time to get good at one of them. You swim. I try and swim in both ponds. And that's why I use guys like you that are so research oriented and so leading edge. It's truly exciting. Give me some of the techniques that you would recommend. So for instance, right now, instrument assisted is hot.
Yep.
I have people coming in and it drives me nuts. People ask for scraping, which it's not scraping. So let's talk a little bit about it. I know you're familiar with it and you do it in your office.
I do. And for the right patient. And that's where I think people get confused, is that they expect the same treatment on every patient, every visit. Well, that doesn't make sense. And the same thing with instrument-assisted manipulation. If you're working with tendinopathies, God, I'm not working my thumbs and my hands over and over again to create an inflammatory response. That's when I'd use instrument-assisted. I'm fortunate enough to know Todd Riddle well with Factor. Those guys are phenomenal. The seminars they put on, I would highly recommend to anybody. And then we're going to start to work together with them and develop different ways of educating people on how to perform that for the right patient at the right time for the right condition. And I think that's important as far as the instrument-assisted manipulation is only doing it when you need to. If you start doing that on everybody, it doesn't make sense clinically.
I agree. And I use Factor in my office. It is my go-to instrument-assisted tool and technique, as they like to talk about it. And it has a multitude of things. It's not just the instrument. There's rehab, there's taping. It's the whole kit and caboodle and what we like. And since so many people are using instrument-assisted, maybe not Factor, I want to bring out the point that you and I both know it's really important to be able to diagnose the condition, since if you're trying to cause inflammation, you want to be able to manage and modulate it. You just don't want to arbitrarily scrape away and cause a bruise and everything like that. And maybe we'll get Todd on here to talk about exactly what I just said. Now, you do a great job of talking active care and passive care. You want to go over some of the things in your office that you do and some of the things you recommend for the field as a leader?
I think that every patient needs to own their problem. The worst experience is when somebody comes in and says, you didn't fix me or you didn't help me. And I always think to myself, this isn't my problem. I didn't create this problem. Your hobbies and habits and activities cause your own problem. And if you don't think that I solved your problem, then realistically, I didn't educate you enough to understand that this is your problem to fix. And I'm going to be a huge cheerleader, and I'm going to be the quarterback behind your care, and I'm going to do everything passively that I can in office to achieve the results that we want to achieve. But if you don't understand what's wrong with you, let's look at tendinopathy. And that takes remodeling of tissue. Is that going to happen in one office visit or 1 week or 2 weeks? No. So setting a patient up on a prognosis to say, here's your exact diagnosis. Here's what it's going to take to get you out of pain. Here are the things that I'm going to do. Here are the things that you're going to do. And in this many weeks, here's what I expect. Then everybody's on the same page and can work towards a common goal. I think as chiropractors, we get confused, though, because our job is not to treat patients. Our job is to diagnose them. And then if they fit into our diagnosis and our treatment pathways for that diagnosis, then let's move forward. Let's get this person out of pain. But our initial goal is to diagnose them and to make sure that we have the tools for them.
So what are your favorite diagnostic tools?
Hands.
Love it. You mean chiropractic's done by hand?
Yeah. I'm very fortunate that a lot of people that see me already have x-rays and MRIs. And not that I don't place a lot of value in that. I really do, because, function determines structure. Ultimately, structure will somewhat determine function later on in life. But as far as my hands, I'm going to get in there and feel what's going on. Now, when it comes to techniques, I love McKenzie. As far as a classification system, I love classifying patients and filling buckets as far as how I'm going to treat them, and McKenzie does a great job of that. I use a lot of their exercises. I think Dr. McGill does a phenomenal job of learning how to classify patients and what patients can do and can't do as far as stability. And I think in school, there's probably not a better organization than Motion Palpation Institute. Mark King and Brett Winchester and Corey Campbell do a great job for the students in understanding how to classify patients and matching the right tool of treatment with the right patient. So those are kind of my techniques that I go to. But as you recognize and I recognize, you can have all the evidence and all the mentors and gurus. It comes down to experience. You and I can probably listen to a patient, and you probably know the diagnosis before you even get your hands on them. And then it just becomes ruling stuff out, more serious pathology to make sure you're on the right track. One thing that I do well is my exam forms are very tailored to the region, meaning I know the most specific and sensitive orthopedic test for every condition. So I can quickly get in there and say, okay, I need to be doing this orthopedic test for this condition to make sure that I'm on the right track and that we can hopefully achieve the goal of pain relief for that patient.
Can the listeners access those intake forms on Cairo Up?
Oh, absolutely. All of our forms, all of our information, all of our rehab, all of our patient education is on Cairo Up in an easy to use format. So hopefully you can take everything that you know as a provider and plug it into Cairo Up. So the next time you see partial tunnel syndrome versus impingement syndrome of the shoulder versus a cervicogenic headache, it automatically dishes out that information through email or through paper format to that patient, so they can kind of get everything that you know about that condition, so that you can manage the active component, which is what the evidence says, and then they can manage the passive component with videos and exercise tutorials, so you guys can both be on the same page.
Absolutely. As I said earlier, I'm a Cairo Up user. So it's a great tool. I think we as chiropractors, if we don't hand them something, we don't talk about exercise, we don't give them some literature, we don't explain to everybody all the time what we know and that we are doctors and we are able to diagnose and here's treatment plans and here's your edification. That's a big thing, you know, an overlying theme that we talked about in patient experience. So Cairo Up enables me to educate the patients and improve the patient experience, which is something, you know, which we really talked about. Speaking about rehab, give me your 3 favorite rehab exercises. I know that's a very vast target, and I'm coming out of left field with that.
No, so I'm a data person. I'm a technology person. I love seeing my stats in practice, and I love seeing trends that I don't think I even have. Now, fortunately, with Cairo Up, we measure stats. So every single time I give a diagnosis, 30 days later, I survey them. It's automated. I don't do it personally. You know, how many times did I see you? What % better are you? How satisfied are you with your care? And on a 0 to 10 scale, how likely are you to provide or to send this provider to a friend? And then we can send them to Google or to your social media platform. But what I really enjoy about that is that I gather data on myself, and I can see where I'm good at and where I'm not good at. But as far as exercise, I can actually see which exercise I prescribe the most. And it's cervical retractions, which is Mackenzie. Yeah, there you go.
Yeah, I'm trying with my torticollis, but I'm trying.
Cervical retractions, and then deep neck flexion exercises. So strengthening the longus colli capitis for the upper extremity. And then for the lower extremity, it's wall extension exercises. So kind of the intermediary between our normal prone extensions and then also our standing extensions. I do start a lot of people off on that, and probably more than I anticipate. So actually my 2 are actually mobility exercises. And if you would have asked that without knowing that data, I would have told you stability exercises, because I'm much more of a strengthening kind of guy versus a stretching guy. But you know, the data doesn't lie. That's my those are my stats.
So I'm going to ask you to send in those 3 exercises, if you would, and we'll put them at the end.
Oh yeah.
So people can see them. That's number 1. And number 2, you said it. I got to ask you: stability, mobility. Can we get some quick definitions and the order in which you want to attack it?
Yeah, you know, I'm one of those people that the reason chiropractic is so great is because we provide mobility. The simple fact is we get people well even when we don't expect to get them well because of manipulation. So you have to restore intersegmental joint mobility. It has to get done. The research is clear on that. How you provide it, who you provide it to, we can go back and forth on. But manipulation does do that. It does provide better joint mobility, restoring normal joint function. But once you have that, you better be retraining habits. And that doesn't mean you have to go through some crazy rehab program or any kind of difficult process. It's if Sally has trouble getting a cup of coffee out of her cupboard and she has shoulder pain, our job is to restore normal range of motion of the shoulder and then teach her how to perform that movement. So scapular dyskinesis exercises, strengthening the serratus anterior. You know what's the funny part is I don't even know the correct program, but that's what I use Cairo Up for. It has all my protocols in there. As soon as I know the diagnosis, it pre-fills the stretching, the strengthening exercise that I need to provide for that patient. But it doesn't provide the ins and outs that's specific to that patient, like teaching somebody to retract their scapula as they elevate their arm to clear that subacromial space. So I think that there is no stability versus mobility. I think you have to be teaching both at the same time on visit 1. And if you're not, then I personally think that we're missing the boat because you have to understand the whole problem in order to get the whole solution.
Interesting approach. I agree. So you're doing active care on treatment 1 in most instances.
Absolutely.
And the literature really bears that out. I concur.
Yeah.
And I think that may be a little bit of a paradigm shift, or where we're leaning paradigm in chiropractic as a whole profession.
Yes.
Yeah, and that's great. And that's a great takeaway. We've been talking to a lot of people on the webcast talking about active care. And I think, I ask chiropractors when they lose patients, where do they lose them to? And they told me they lose them sometimes to a medical doctor because it's a condition that's not really in our armamentarium, and or they went somewhere for exercises. So that shouldn't happen. That really shouldn't happen. Tell me, why did you start Cairo Up?
I think I surrounded myself with a lot of really smart people growing through the profession. And I realized I was never going to be smarter than them. And I realized in practice that I was just taking stuff that they had already taught me, and then it was my job to deliver that to patients, and my job to continue to learn from them and continue to learn from the research, and hopefully, take the experts in the field, whether it's Todd Riddle teaching me how to do insulin resistant manipulation, or McGill teaching me how to do the big three, or Brett Winchester teaching me how to rehab the shoulder. And it's really my job to disperse that information in a very quick process. And the way that I was doing that was teaching patients how to do those things, but it was taking up a lot of time. So I quickly realized that I need to have a computer program to do that for me. And that's where KairoUp came. And it was not designed to sell. It was not designed to be around the world like it is now. It was designed for me, for my practice, because I was just being selfish with my time. And it's turned into something that has been more innovative than that, that we continue to learn from our providers on who's treating which conditions. And while I used to know who the gurus were in certain, nutrition with Dr. Silverman and stability with Dr. McGill, I'm learning things from other providers in Louisiana and Australia, things that I would have never thought I would learn. And we have a platform now that we can learn from each other and hopefully get the best outcomes. And if my outcomes of plantar fasciitis were better than yours, would you want to know what I was doing differently?
Immediately. And absolutely. I concur with you.
Yeah, so it's taking the doc in the box mentality and saying, you know what? Let's throw egos aside. Let's throw a little humility into the profession, and let's learn from each other so we can be the best choice for patients and payers, and insurance companies. That people want to see our product. They want to come into our offices because they know we provide the best product.
I agree. I know you lecture like I do. And I learned so much from the attendees. And so the people that we surround ourselves with the attendees, and I always thank all my attendees, and I know you have a similar feeling as we've talked, that I thank everybody for coming because I got to learn from them. To speak to that, where's Cairo Up going in the future?
We're doing some fun stuff. So we're currently redoing the entire website just for user functionality. We have a patient app that's coming out in 2 months. And then now patients are going to have an app on their phone that you can communicate with them, and also have all their exercises, reminding them to do the exercises, checking in with you on their exercises. And we have some functionality that we're going to start sharing protocols. So I can start to see what you're doing for small intestinal overgrowth. I can see what Dr. Riddle is doing for Achilles tendinopathy. And we can actually start to download and utilize different people's protocols and policies and patient education. So not only are we learning from people, but you can walk out of a seminar, a seminar that you learned something about the shoulder, and no longer you just said, okay, I learned this information, now I need to implement it. Now we're going to have the ability for that seminar speaker to shoot out their protocols. Say, listen, you learned everything this weekend. Now you can start using these protocols in your office on Monday, and it's done for you. So just trying to make it easier for people to disperse information and hopefully be the thought leaders and think of all the things that chiropractors do and make it a little easier. We have some other ideas on note-taking, and we have some other ideas on scheduling and marketing that in the next year are going to be coming out. So I'll hold back on those, but everything else will be, we like to be the Apple. We're nowhere near Apple, but we try to be innovative and think of things differently and come up with solutions so we can all practice a little easier and maybe have a little time to spend with our family also.
Work-life balance. And you are one of the thought leaders without question. So being a thought leader and having Cairo Up, how can they get in touch with you?
So I can be contacted by email, brandon@KairoUp.com. and I'll answer emails within 24 hours. I'm a practicing chiropractor just like yourself. So everything we talk about, I try and practice and work on patients on a daily basis. And my links, KairoUp.com is where people can find information on that. As a provider, I work at Premier Rehab in Swansea, Illinois, and you kind of see how I run my practice. But yeah, if there's any emails, or we have a lot of students or doctors come into our practice and see how we run things, and we have people in and out, cycling in and out of our clinic on a daily basis.
Outstanding. Dr. Brandon Steele, Cairo Up, I use it. Dr. Rob Silverman, Proven Health Alternatives. We have to do it again.
All right. Thanks a lot.
All right. See you guys soon.